before, prevention is better than cure, and so if we pick things up very early, that's really the stage to get in and try and institute some treatment.
So it is valuable. And things can change within that period of time. So, for example, the kind of blood tests, the blood glucose might be something, for example, you look at.
The blood sugars, you can never quite tell when that is going to change. You know, you could, in theory, test it 1 week and test it the next week and it'll be high because it has to change sometime. Realistically, we can't go checking people's blood tests every week. I mean, you know, nobody would thank us for that. But certainly when we see you on a regular basis, you know, once a year or once every 6 months is reasonable just to look at something like that. Because diabetes is something that can cause all sorts of problems, but is actually very easily looked after.
And if you catch it early, you might not need as aggressive a treatment. So diet and change like that, for example. Okay, that's very helpful, Andy. I know it's a bit intimidating to actually put your hand up and ask a question, but if anybody does have any questions. Yes.
I actually go between the RBI and the female.
Yes.
I've picked up the disease which has been confirmed from mum.
Yes.
That's been passed down from grandfather and his mum.
Yes.
But the main question is, when I came to see Mr. Griffiths and had the eye test, it come back. I thought it would come back as I've never had any problems whatsoever with my eyes.
Sure.
As far as I was aware, I had perfect eyesight.
Sure.
But that come back as a negative, and it did show the twinkle mutation.
Yeah.
But they've also found out that there is a problem with the left ventricle of my heart being very swollen.
Yes.
So could there be a link between
I think one of the things that we've got to be very careful we don't spend too much time actually on individual things. It really is this important point that you kind of make is, and that's why we do it. You might think you're going along with problems with your eyes, but you might actually have a problem with your heart as well. And actually detecting that at an early stage is certainly something that we can do a lot about. There's an awful lot of evidence now that picking up early heart defects is something that we can do, because sometimes the wall of the heart gets too thick and that can constrict the heart pumping. And that's why most of the patients that come along will get cardiac tests. I mean, in theory, everybody should. Everybody will get a blood test. Most people will be checked for other things that we think that if we can get it early, we might be able to prevent. And that's what's key for us, I think. And key for you is if we can get in early, we can start to prevent some of these complications occurring.
Okay. If there is anything else you want to ask, just catch us in the break, and then we can talk on a sort of one-to-one basis.
Yes?
I come along twice a year and I always give blood. And I fully understand about looking for diabetes. But when I watch the lady taking the blood, there's so many different bottles. I've just wondered what other sort of things to look for.
Okay.
Shall I take this one?
Yes.
Yeah, okay. We generally take the approach that if we're going to put you through having a needle put in, we should check the things that we know can cause problems, you know, rather than a week later asking your GP to take another blood test. So that's why we tend to do them all at the same time. We'll tend to check the blood sugars looking for diabetes. Another sample, usually the yellow top tube you'll see them taking, we look for the kidney function, okay, to see whether that's looking after things properly, and that also looks at the salt levels in the blood, because those can occasionally in some patients drop a little bit low. We also look at the function of the liver function tests. We will often look at a muscle enzyme called creatine kinase to see whether that is elevated, which implies that there is a degree, not usually too much, but a degree of muscle damage that is ongoing. We will also sometimes look, depending on when we last checked it, for the thyroid function, okay, which I touched on earlier on, because occasionally if somebody comes in saying I'm terribly fatigued and tired, and etc., well, that's probably the mitochondrial disease. But mitochondrial disease does not make you immune to other conditions, and it would be wrong of us to miss something treatable like thyroid disease because we assumed it was something else. So we do that as well. There's a purple top tube that looks at whether you're anemic and whether the white blood cells and the immune system are doing okay. Those are usually the ones. Occasionally we'll look at something called autoantibodies just to see if you have a tendency to your own immune system causing problems that we might have to look at as well. So those are usually the ones. Occasionally we'll take a genetic test, which we discuss with you at the time, if we need to sort of look further at diagnosis. Does that explain it?
Yes.
Super.
Yes.
All right.
One thing on this, which we talked about, is the mitochondrial disease can be passed on through the female side. But Andy, he's mentioned about some strains being passed on.
Right, yeah, I think what I just want to do is, the problem is the genetics of mitochondrial disease is very complex, as Andy thinks. And what we do is we give people individual advice, because some can only be passed on due to the female side, some can be passed on by men. We give you individual advice because you do need to have individual advice, right? And I think that's something that's very important that we get this over, is each of you is an individual. You all have your particular problems, which is why we need to treat you independently in the clinic. But the genetics of mitochondrial disease, we could be here till next week trying to explain it to you. It's very complicated, which is why we, and to us, yes, which is why we have to keep, we do it on a specific thing. I think we'd better move on, otherwise we're not going to get a tea break. If people want to ask Andy anything in relationship to his talk, Sue, do you want to give that Sue a thing? Yeah. If anybody wants to ask Andy anything in relationship to his talk, please do catch him at tea time. Those of you that know Andy know that he's very approachable and always very happy to answer questions.